Good morning. I appreciate the opportunity to talk to you all today about some exciting technology that I've been working with now for probably about 6, 7 years. So we're going to be talking about light technology and sound technology to screen for oral and systemic diseases. As you'll see in a moment, I'll tell you a little bit about who I am. Part of this technology that you may all be familiar with is a technology called VELscope. When you think of VELscope, you may think of oral cancer, and it certainly is marketed and has FDA approval for marketing for oral cancer screening. It hasn't caught up a lot of traction because of its oversensitivity. But I'm going to show you how using this technology, as you broaden your basic understanding of science, that you'll understand how this technology can be used to look for oral pathogens that will colonize in the oral cavity. And I've always been a dentist for 39 years. And I'm a laser guy and a light guy, so to speak, with the diagnostic principles of utilizing light. And now I'm a sound guy. So one of the areas that's foremost that you may have heard about is sleep apnea, but we'll talk about other wellness issues also, like cardiovascular disease and metabolic syndrome and thyroid disease. Hopefully, I've invited a few of my medical colleagues and they've joined us. I feel very honored that I might be a conduit to bringing the oral systemic issues together. As you can see, I'm Randall Weisel. I'm a dentist, and I have a master's degree, and I have a fellowship in the Academy of General Dentistry. To get through the formalities for the day, everybody that you see, when you'll see some of my research that I'm presenting to you today, I do have consent forms. I do want you to know that I do have a financial relationship with VELscope and HealSurron, but that's not why I'm here at all. I hope I come across with that passion. This technology, both of these technologies which is VELscope and ultrasound, are very important imaging technologies that won't harm the host when we use them. To review today's program, we're going to review obstructive sleep apnea and some of the comorbidities. We're going to show you some of the present screening options for obstructive sleep apnea. Then I'm going to show you about utilizing the new technique, or this technique that's an old technique for oral cancer, and utilizing it in a more broadened sense to look for disease processes. I'm going to give you a few case reviews, and then I'm going to, the third part of this presentation, and I really want to express my thanks to Tracy Jacobs and Stella Life for allowing me this venue to bring this technology out to you all. Then we'll go through a summary and then a question and answer, and that's going to be part of today's program. I went to Wabash College 100 years ago. I have a degree in biology. I have a doctor of dental surgery from Indiana University in 1984. I did earn a master's at Lynn University, which is down in Boca Raton, Florida, in 1994, in biomechanical trauma, which is an interdisciplinary program. It was one of the first distance learning programs. I worked with other disciplines of physicians and how they approached biomechanical trauma to the body. I earned my fellowship in the Academy of General Dentistry, and I'm on the track. I have enough hours. It's just a kind of administrative thing to get my master's certificate. So I'm very proud of. I was mentioning to the young man who's helping, and thank you so much, Jeremy, for your professionalism, that I also earned a degree or a certificate from MIT recently in artificial intelligence in healthcare. One of the reasons that I got directed in this way, one, my son is one of the foremost project managers in artificial intelligence in retail and e-commerce. He works with a company out of San Francisco called iFi. I have been active in politics, though I'm not politically oriented. Have been a member of the Academy of General Dentistry, and I was on the board of directors for Florida for several years, and I was also the editor, besides the membership chairman for that group. I have earned a fellowship from ICOI in implants, and then I'm a clinical mentor for Heartland Dental, DSO. That's who I've been involved with now since 2013. And I mentor the Heartland group monthly on lasers. Very proud of that. Part of this program, though, is I want to give my gratitude to two of the top leading physicians. Well, Dr. Bradley Bales and Dr. Amy Doneen. Because of some health issues that I have had in my life, I have been blessed to come across ways to beat the genetic expression of heart attacks. A quick side note, I've had 2 heart attacks and survived them, with the grace of God. And in this process, I came across Dr. Bales and Dr. Doneen. If you have a chance, please pick up that book and their new one called Beat the Heart Attack Genes, because they are pioneers in recognizing cardiovascular disease and how it's related causally to gum disease and oral disease. Getting right into the process, we are the masters of the airway. So that means basically everything in life goes through the oral cavity, and most people would say they want to go through the nasal cavity, but breathing starts through that process. And we are part of the healthcare team, and we need to take that role. Hopefully by some of the things that I tell you today, you'll have a better handle on understanding what I mean by that, because sleep apnea has now become a big buzzword, and sleep medicine is a big buzzword in healthcare. Some of the research done that we're seeing in nutrition, there's another book that I want you to consider getting. It's just come out, called Metabolical by Dr. Robert Lustig. He's a endocrinologist and the leading endocrinologist, and he understands how metabolic processes are really kind of guided by oxygen and the airway. So I've been very fortunate to be able to start a discussion with Dr. Lustig, and his book has been very, very helpful in my process. So if you need that information later, please contact me, and because my door is always open, my phone's always open. I love to talk about this. This is my passion. One, as I already told you, it's personal to me. And knowing that 80% of the people walking around this earth probably have an airway patency issue that most likely causes oxygen desaturation processes, and it's mostly expressed or happens when they sleep. This falls under sleep apnea. So as I go into this, and I do it every day with my patients because of some of the healthcare issues that I've had. I've already told you that I've had 2 heart attacks. I have 8 stents in my heart also. I have metabolic syndrome, and I have diabetes. Everybody looks and say, wow, that's wild. And I've had cancer. Need to leave that. You can, through nutrition and lifestyle, you can control the game. Healthcare system is broken, and I'm very appreciative of the healthcare system and the fact that it saved my life, but it never really addressed how I might be able to help in my process. The term healthcare to me, and I say to my patients every day, your health, guys, is your responsibility. So you have to learn, and your patients' health are their responsibilities. Don't let them dump that on you. You give them information to help them. Care, on the other hand, of that health care is a question of who's paying for it. That's what we've been, I believe, the term gaslighted to feel is that somebody else should pay for it. I don't want to get into that politic issue, but your patient's health are their responsibilities. As healthcare providers, it's our responsibility to give them the information and hopefully guide them in the right direction so they can live a long, healthy life. Today's program we're going to put together is focused on 3 different technologies, which in my opinion have similar relationships of chocolate, marshmallow, and graham crackers, s'mores. And I think that probably got my health issues and my genetic expression in trouble early on, not to say everything in moderation. But as you'll see, I'm going to talk about 3 technologies. 1 is VELscope. 2 is home sleep studies over here. And 3 is ultrasound. These are powerful tools that we can use to help our patients. Sleep apnea, definitely, I want to concentrate on give you more information on sleep apnea, although in my opinion, it is related to oxygen desaturation. I also do IV sedation, conscious sedation with my patients. And a lot of my journey has been through my educational process in that realm. 1, using pulse oximeters and understanding how oxygen desaturation is so important to metabolic processes in life. This usually happens when they're sleeping, hence the term sleep medicine. And it is big money in big healthcare. If anyone, I think a number of us realize that our patients have airway patency issues, and a number of our patients are most likely using CPAPs. But with this process, snoring, upper airway resistance, and the sleep apnea, which can be obstructive sleep apnea or centralized sleep apnea, which is less prevalent, can be an issue too. It says, basically, the research says that up 60% of the population in the United States have sleep apnea. I'm going to tell you it's more like 80. Definitely, this falls under those realms of snoring, sleep apnea, upper airway resistance fall under what's called sleep-related breathing disorders, which are really primarily a chronic lack of oxygen. I coined a term that I use, and I believe that will catch on. It's called oxygen desaturation syndrome. There's been deoxygenation by Dr. Lustig. I believe it's one and the same. But chronic oxygen issues, which start at birth and maybe even start in the womb, basically can cause localized and systemic inflammation and can cause infection, which these conditions can lead to accelerated aging and expression of genetic mutations that your patients, we all have, and that our immune system is fighting every minute of the day, and ultimately can kill you. Sleep-related breathing disorders, as we went over, but we will reiterate in the learning process, is snoring, upper airway resistance, obstructive sleep apnea, centralized sleep apnea, which is where your respiratory centers of the brain are not set at a level that would cause the patient to breathe when oxygen levels go down or desaturation occurs, and CO2 levels increase. There are 3 barometers in the body, in the brain, in the carotid arteries, and in the heart that control that. It's important that we realize as dentists and dental healthcare professionals that we cannot diagnose sleep-related breathing disorders such as sleep apnea or upper airway resistance. Our physician colleagues have kind of cornered that, but we certainly are part of the healthcare team, an important part of the healthcare team, and I believe that people like, colleagues such as Dr. Lustig and Dr. Bales and Doneen are seeing that. I'm sure as dental physicians of the head and neck, you've had referrals back for clearance before your patients would undergo certain surgeries. And they're looking at making sure mainly that certain pathogens aren't causing issues within the body, such as inflammatory issues or direct issues from the pathogens that could cause other problems during the surgical procedure or during the process of trying to heal a disease. A dentist has been urged by the ADA at the House of Delegates in 2017 that we should be screening for these sleep-related breathing disorders. So as part of our collaborative with other healthcare professionals and what our patients deserve, they deserve our knowledge and our expertise in giving them information that they could possibly better their lives or keep from having a catastrophic process. Some of the comorbidities directly or indirectly related to sleep apnea are cardiovascular disease is number one. Cardiovascular disease is the number one killer of men and women in the world. It's not COVID. It's the comorbidities. COVID is just a element that can cause these other comorbidities to be catastrophic. Alzheimer's and dementia are definitely related to sleep-related breathing disorders. All this is that I present to you is in the research, and I would be glad to give you that information if you want to reach out to me. Diabetes, for sure. Dental disease. You got to realize that the part of this process we're going to talk about today, and I'm going to give you some information that will probably be controversial to you, that cavities, and which are caused by anaerobic microbes, strep mutans, and lactobacillus, and periodontal disease with all the types of anaerobic bacteria present are, again, termed anaerobic. That means our patients are really petri dishes for these bacteria to colonize. I will tell you briefly, in my opinion, the alpha colony of these diseases such as caries and periodontal disease, because I'm seeing it in my practice, and hopefully we'll have the ability to soon publish on it, there are the dorsum of the tongue. And that's what VELscope is going to be so important for you all to be able to see, and we'll talk about that a little later. Cancers, thyroid disease. I have, as you'll see later, I've sent hundreds and hundreds of patients to their physicians because anyone who has an airway patency issue, a chronic airway patency issue that causes oxygen desaturation issues, has the thyroid organ which is a metabolic regulatory organ, affected. That doesn't mean it has a disease, but it's been metabolically affected. And by virtue of vetting it in my practice clinically, I've seen well over 3,000 patients who have hypertrophy of the thyroid. Know that kidney disease, obviously pregnancy issues, non-alcoholic fatty liver disease, peripheral artery disease, and erectile dysfunction are all related to sleep apnea, and there's a plethora of research. As I had mentioned to you before, there is evidence that we are the gatekeepers of the oral cavity, and we need to be aware of these processes, not just fixing broken teeth, but the relationship of the oral manifestations to the systemic manifestations. Again, the ADA at the House of Delegates 2017 had expressed this. The methods for screening for sleep apnea, some of you may be aware of what these are, some of you may not. One is the Epworth scale. The other is the stop bang. These are self-report mechanisms that have been meta-researched to show that when they fill them out and they have a number of pluses on that they have these manifestations, that there's a high probability of sleep apnea. Physical examinations, health assessments, fluorescence, which is using the VELscope, and sleep studies are all important methods for screening for sleep apnea. Our job is, in most cases, is just to facilitate our patients to go to the next level and have a sleep study. This is an Epworth sleepiness scale. As you can see, when they fill it out, basically what it will do is they will, and you add up the numbers, a score of 10 or greater can raise concerns, and they need to have that information so they can go to their primary care physicians or their doctors and talk to them about that. The Epworth scale has limitations, though. It's got variability and can't be used as a sole tool. That's why I said, I firmly believe some of the technologies I'm going to show you will catch on, because what I have seen with using the VELscope, it is a high sensitivity, well over 90%. If there's certain presentations with the VELscope, these patients have oxygen desaturation syndrome that most likely is sleep apnea, and you can give that information to them or guide them to have a sleep study. This is a stop bang. It's a little bit more comprehensive, and it will talk about the blood pressure, which is directly involved cardiovascularly. You'll look at use a tape measure around their neck, and you'll look at their BMI. Sometimes that can be a sensitive issue, but this information has to be, it's part of their biomarkers that they need to be aware of, and they need to be educated on what may be going on. Stop bang is definitely effective for people who have severe sleep apnea, but it loses its credibility almost less than a flip of a coin as a predictor for mild or moderate obstructive sleep apnea. Again, you can see at the bottom, this is not backed by Dr. Weisel's research, but by sound meta research. I want you to remember, as dental healthcare providers, we cannot diagnose sleep apnea. We screen for sleep-related breathing disorders, and if we suspect it, whether it's through clinical examination, whether it's through any of those processes that I showed you, and I believe it's going to be pretty clear if you understand or start using the VELscope, that it's going to be very simple on knowing that these patients may have sleep apnea, and then we can facilitate by virtue of suggesting that they have a sleep study. There's two types. One's overnight in the lab, and it's going to cost someone about $4,000 to $5,000. There's a second type, which is caught on very, very highly. That's called HST or home sleep studies. The research is showing that the efficacy of both are, especially for obstructive sleep apnea, are very close. Most insurance companies will not allow an overnight sleep study without having a home sleep study done first. That's why I said sleep study, that's where this all gets cloudy, because it can slow the process down. When you see certain representations that I'm going to talk to you about, you already know they have an airway patency issue. They have an oxygen desaturation process. They're infested with pathogens that are stealing vital nutrients from them. But medicine has made it clear that if they're going to have the care part of healthcare done, that they're going to have a sleep study, or there's not going to be any consideration of the insurance companies to participate. In fact, Medicare, if your patient's Medicare age, I guess 65 and older, I'm approaching that quickly, that you cannot facilitate or order a sleep study. You can order a sleep study if they're not Medicare, and most likely it won't be a big deal if you have a home sleep study done, because the average cost of a home sleep study is between $250 and $500, and that's usually below what their deductibles are. But as a Medicare participant, as your patients, their primary care physician has to facilitate this to get coverage of any kind. Well, when looking conservative target, 40% of the people who have sleep apnea, assuming that we see 120 patients a month, and this is actually from data that I had, 48 of my patients would have, if it was 40%, 48 patients should have a sleep study. That's about 2.5 or 3 patients a day. If you're identifying 2 to 3 patients a day, then the average office should be submitting these, that type of numbers, not 2 a month, which is what some of the research is showing. So we need to up our game to help our patients with a disorder that's causing disease and ultimately burdening everyone, burdening the patients by virtue of getting sick and sicker and becoming into polypharma issues, because healthcare is more whack-a-mole. They're treating symptoms. Most of their physicians, because they have 7 minutes to work with their patients, they don't even talk to their patients. They don't even talk to themselves, between themselves and what's going on. This is a missed opportunity. If you want to look at economics, again, this isn't part of this presentation, or it's a small part. Some of you will look at, well, how can I make more money? These are opportunities to make more money. But the bottom line here is you're doing a service for your patients. So, again, we're missing life-threatening diseases if we aren't looking at sleep apnea. I hope you have kind of got that kind of mindset after what I've said. They see us more often than they see their primary cares. And we are physicians of the head and neck. So we need to reinforce this information to help our patients. Insurance. Again, we are working with medical insurance, but we haven't crossed that bar. We are using dental insurances. So again, it comes down to it becomes personal and understanding to you. This is an issue, a major issue that I said I believe at least 80% of our patients have. Then it's our job to screen and educate, and then the process will, go on. Screening is the definition is just performing a preventive measure to detect potential health problems. So early detection is going to be so vital in reducing the risk of disease. Late detection, you can give them information on how to reverse it. I'm living proof of that. And I think that our medical colleagues, such as Dr. Lustig and Dr. Bales and Zonine, would agree. So we're going to kind of take a break here and for a few minutes, and then we're going to talk about a new way to screen and communicate to our patients.